So it is a big question for the patients that, or for the doctors also, fertility specialists, that whether to go for an IUI cycle or go for an IVF cycle. So now let us come that why you need an IUI or why you need an IVF. So basically IUI, because what happens when the patient comes to the OPD, they always say let's go for an IUI cycle. Nobody wants to go for IVF cycle, but they don't know that it is not their choice to get an IUI or IVF done. It is by compulsion, it is by causes, or it is by the reasons of infertility that they will require either an IUI or an IVF. First and foremost, let us see that what all are the points that are responsible for infertility. Basically, one, uterus is there, the ovaries are there, the tubes are there, fallopian tubes, and obviously the semen, the sperm is there. So if the fallopian tubes are blocked, if both the fallopian tubes are blocked, then definitely there is a direct indication for going for an IVF cycle. There is no role for IUI, because in IUI what happens, the tubes have to pick the eggs and the work has to be done by the fallopian tubes. So when we are doing the IVF for blocked fallopian tubes, we are bypassing it. But if the patient has got one fallopian tube open, then they can go for an IUI if the egg is made on that side, on the side in which the fallopian tube is open, and all other parameters are normal, then only they can go for the IUI cycle. Secondly, if the AMH is less, in like patients whose AMH is below the normal fertility range, like it is below less than 2.2, they should not opt for IUI or natural conception cycles, because in their cases the egg that is being formed is already on the lower side and they should not lose their time. They should start the IVF cycle as soon as possible. So if this is the cause, then you have to go for the IVF cycle. Thirdly, if the patient has got severe PCOD, in that cases also, because the egg quality is very much deteriorated in a patient with severe PCOD, they have multiple trials, still they are not able to conceive. In these cases also, the patient has to go for the IVF cycle directly. They should not keep on trying IUI cycles, because what happens when we keep on trying, you keep on spending your time, and then what happens when substantially you think of going for the IVF cycle, then till that time the egg reserve has already become very bad. You have to land in donor cycles. If the sperm count is borderline, means the sperm count is somewhere around like 10 millions, 15 millions, we can go for an IUI cycle. But if it is less than 10 million, or the normal morphology is not, it is not more than 4%, the normal morphology is less than 4% in the Kruger's criteria, you should go for the IVF cycle directly, IVF ICSI cycle. You should not wait. If your count is very good, you are having a 50 million, 60 million, say 100 million count, but the morphology is less, it is less than 4%, there is no role for IUI cycle. Because what happens, half the time the patients, they are seeing only the motility, they are not seeing the morphology of the sperm. So it is very clear, if the morphology is less, you have to go for a ICSI cycle. Plus in the motility also, the progressive motile is very important. If the progressive motile is less, it is less than 20%, you should not go for the IUI cycle. If it is less than 32%, obviously you need to see a doctor, you need to go for either IUI or IVF, and the specialist decide if your the morphology is normal and it is somewhere between 22 to 32% the progressive motile count, then obviously the semen washing is of help. But if the progressive motile is less than 20%, you should not try the IUI cycle, you should go directly for the IVF or ICSI cycle, because the IUI cycle that you are going to undergo is going to fail definitely. So don't take that chance. So these are some of the parameters in which there is a dwindle that whether you should go for IUI or IVF. If there is an advancing age and you have been trying for long, you are having unprotected intercourse, you should try for IVF directly. There is no role for going for IUI cycle, because the success rate in IUI cycle is somewhere only around 10 to 20%. It is far less than what is there in a IVF cycle. So it is you and the fertility doctor who have to decide vis-a-vis whether you should go for a IUI cycle or IVF cycle. It's not like I will try IUI 3 cycles, then I will go for IVF, because the time you will lapse, the gametes which you are going to lose, that will then again affect your success rate for IVF cycle. So it is you who have to decide whether this or that. We care about you.